Hey there, it's Dr. J and Evan today. We got an awesome podcast. It's a great Friday. We are live too. So anyone that's tuning in and wants to get some questions asked and or answered, we are stoked to be able to do that. Today's topic is going to be on enzymes and how they can be used therapeutically to help with digestion and to overall improve your health. Evan, what's going on, man? Happy Friday.
Happy Friday. It's beautiful here. The trees are blooming. It is freezing though. We went from 70 degrees to like 30.
Really?
So hopefully spring is coming because I'm ready to get outside again as soon as possible and go for an extended distance hike.
Got it. And people on Facebook here, if you're not hearing Evan, do your best to head over to the YouTube channel, youtube.com/justinhealth, and click on the live view so you can see Evan's beautiful mug staring back at you and get your questions answered. I'll try to be able to answer questions on Facebook as well as YouTube. So feel free and ask.
Perfect. Yeah. So enzymes, where should we start? I mean, this is the importance of health. This is important for longevity. This is important for preventing or reversing disease because you've got to be able to break down your foods with enzymes to be able to actually absorb the nutrients. Time and time again, you and I run organic acids panels on people where we look at amino acid metabolites and we look at these other biomarkers where we find that people are just not digesting their food and they're not absorbing or assimilating any of their nutrients despite them spending hundreds of dollars a month on food and organic food, or they're on an AIP diet and they're buying grass-fed beef and organic veggies, but yet they've got all these symptoms because they have low enzymes. So they could have hormonal imbalances, they could have fatigue, they could have excessive hunger, they could have sugar cravings and carb cravings, which all could be tied into this enzyme deficiency because they're just not breaking down their food. They're stressed. They're not chewing their food well. We're going to break all this down today.
Absolutely. I love that. So off the bat, let's talk about how your body can actually make and activate enzymes first. I think that's a really important first step. So enzymes are primarily going to be stimulated through the digestive processes and primarily the parasympathetic nervous system. So the more your nervous system is parasympathetic, right? That's the rest and digest. The more you're going to have a nice low pH in your stomach. You're going to have gastrin stimulated, all these gastric juices coming about. That's going to lower the pH because a lot of enzymes, they're actually pH driven. So if we don't hit that first domino of parasympathetic nervous system, stimulate the nice low pH, and the nice low pH is from hydrochloric acid. Hydrochloric acid kind of also has a sterilizing effect. So if you get some bad kind of junky food in there, it's going to have like an effect of taking maybe some bleach and putting it on a public picnic table. It's going to help clean it up so it's going to be more sterile environment. So think of hydrochloric acid as like the bleach in your tummy. It also activates the proteolytic enzymes. It starts with pepsin. It takes pepsinogen to pepsin. So it gets the digestive enzymes going. And that nice low pH, all that food gets mixed up with that hydrochloric acid and then eventually goes down in your small intestine as released as chyme. And then it stimulates the pancreas to produce more enzymes and the gallbladder to produce more bile, which will help with fat. So that's kind of the first domino reaction. And it starts with the parasympathetic nervous system response. And it starts with having good hydrochloric acid levels. Now, one thing to talk about here, how can we stimulate our own juices? Number one, chewing your food well is going to be super important. Making sure you really chew at least one chew per tooth is a pretty good rule of thumb. Number two is making sure you're in a parasympathetic state, not eating and being on the go or eating when you're in the car. Have a good relaxation kind of state. Number three, making sure you're hydrated because a lot of the digestive juices come from the liquids that you eat. And then number four, not consuming water for the sake of hydrating while you're eating. The more you consume water while you're eating, think about it. Water's got a pH of 7. 7's going to take the pH in your gut at 2 and bring it up closer to 7. So these enzymes are pH driven. So the lower the pH, the more the enzymes are activated. The more water you drink during the meal, the more you dilute the enzymes that are already there, the more you raise the pH and you deactivate future enzymes from being produced. What do you think, Evan?
Yeah, so if people want to know the number about the stomach, it's very, very acidic. 1.5, sometimes 1.2 to 3 is the range of the pH. I mean, this is so intensely acidic that if you opened up that HCl out of your stomach and poured it on your shoe, it would melt your shoe into pieces.
Absolutely.
But you've got to have that. And I want to just repeat that because you said it well. But in order to activate pepsin and your other enzymes to break down your protein, you've got to have an acidic enough stomach. You've got to have enough HCl production. And so you've got
Absolutely.
these parietal cells in there that are making the HCl. But if you're in sympathetic fight or flight mode because your body thinks you're running from a bear, even though it's just running from email, or you've got a bad boss, or you just got some bad news, or you're eating during a meeting, or you're eating at your work desk, these are all things that are not going to trigger that release.
Totally.
You're going to be setting yourself up for, tummy trouble. And we can talk about some of the implications of what happens if you have this hypochlorhydria state, which is this low stomach acid state that then basically sets you up for infections and things like that, which we'll get into.
Totally. And again, we get questions coming from Facebook, and I apologize. People on Facebook are only seeing one side of the conversation here. But hey, Steve, how you doing? Off the bat with the gastric ulcer situation, if people have an ulceration or have gut lining issues in the stomach, one of the first things we do off the bat, if we know that history is present, we're going to use gut healing and soothing nutrients first. We're going to use bone broth. We're going to use aloe, slippery elm, deglycerized licorice, L-glutamine, and we'll kind of coat that stomach there. We'll make sure the food's well broken down. We may even focus more on a GAPS kind of approach and have more liquid soups that are really easy and palatable. And we may focus more on enzymes first. Now, depending on how someone's doing, how sensitive the gut is can be a good measure of how the gut's healing. So that's a good sign. So you can start with like a 1/6 to an 1/8 to a 1/4 of a teaspoon of apple cider vinegar with food. Now, if we're going to add any acids in, you can start with light acids such as apple cider vinegar and or just plain old organic lemon juice, and then do it with food. Because if the stomach is empty, it's like someone touching your raw sunburned skin. It's going to be more sensitive. Put a little food in there, do a nice gentle, very low dose of acetic acid, whether it's in apple cider vinegar or citric acid in the lemon. That's a really good first step. 1/4 of a teaspoon and upwards, and gradually work your way up. If that's good, once you get to a full tablespoon and have no problem with food, we can transition you to an actual hydrochloric acid tab with pepsin. But in the interim, healing, soothing nutrients, and then we taper, we focus more on the enzymes and the HCl because they're less abrasive.
Let's back up a bit. Let's talk about symptoms people may be experiencing if they need enzymes or if they're in this hypochlorhydria, low stomach acid state. So I would say any type of burping or gas after eating, that tells us you're not breaking foods down.
Huge.
If you were a vegetarian or a vegan in the past, a lot of times people go vegetarian or vegan because they say they've lost the taste for meat. But in many cases, that's just because they don't have enough stomach acid to digest meat. And so they think that meat's bad for you, but it's not. Heartburn. A lot of times people have heartburn, but it's actually too low stomach acid, not too much. You've got that valve at the bottom of the stomach, and it's kind of a regulator. And if your food's not broken down, your body's smart. It doesn't want undigested food in the intestine. So if it can't go down, it can only go one place, which is up. What about the lower esophageal sphincter? Could you talk about that maybe from like a chiropractic perspective about how that valve can get stuck open? I mean, can adjustments and massage and stuff help that, or is that more internal work that has to be done?
Yeah, I mean, you have different issues with the various sphincters that go from the esophagus into the stomach, and then obviously the stomach into, hold on one sec. I got a little reverb here. Apologize for that. Okay, so regarding that, you have different sphincters that go from the stomach to the small intestine, from the small intestine to the large intestine, and obviously from the esophagus into the stomach. So the key elements here is we have to make sure the first domino is going to be the esophagus to the stomach, right? If we don't have enough acidity, what happens is that esophageal sphincter stays open. So this is one of the major reasons why stomach acid actually helps a lot of people with heartburn. It helps two ways. The esophageal sphincter gets tightened when there's enough acidity. And then number two, food will rot and putrefy and ferment, and organic acids will rise up from the food. So if there's not enough acidity initially, that esophageal sphincter will stay open. food will rot, and then those acids will rise up and burn the esophagus. So two mechanisms: tightening of the sphincter and the breaking down of the food. If we don't do that, it rots. So that's step number one. Step number two, food goes from the stomach to the small intestine. If we don't have enough acidity, then we're not going to trigger the bicarb release from the pancreas when it goes from the stomach to the small intestine. We're not going to trigger the gallbladder, and we're not going to trigger the bile salts. Number three, it goes from small intestine into the large intestine. If we have dysbiosis and low stomach acid and low enzyme environments, we can have kind of ileocecal valve patency, where this is kind of the first mechanism of SIBO, where the bacteria from the colon will start migrating its way back up to the small intestine, and then we start getting all kinds of extra methane and hydrogen gases increasing, and that's going to create more malabsorption, more diarrhea, more constipation, more of those IBS kind of sequelae. And then
I wanted to ask you one thing, and I know we're a bit biased because of the people that are coming to us. Typically, they've been to 5 or 10 or 20 different practitioners before they get to us, which is mind blowing, and it's an honor. What % of people have a low enzyme state, low stomach acid state, therefore potentially SIBO state? I mean, you and I see bacterial infections. I'd almost say it's every 9 out of 10, but I wanted to see what your number is.
Yeah. So how many people, 9 out of 10 or out of 10 here, do we have bacterial infections? I would say at least half have some type of digestive issue minimum. I would say out of the general public, I'd say the people that see us, I would say 100% have some level of a gut issue, even if someone doesn't know it, because people come in, let's say they don't have a gut issue. Let's say it's hormonally driven. If it's a female, it's going to be PMS or mood issues or brain fog, or if it's a man, it's going to be energy, focus, endurance, exercise, muscle mass, low libido. Again, those issues can all be affected by the gut and a couple of different mechanisms. And kind of tying it back to enzymes, we always go in our diatribes here, but if we don't have enough enzymes and digestive capacity, all the nutrients that make up all the brain chemicals, which help us focus and think and deal with stress, also the nutrients that help become our hormones. So the cholesterol and the essential fatty acids, they're going to become the precursors to our cortisol and our sex steroids. So if we have any digestive issues, any of that could be thwarted by low stomach acid and enzymes. We're not going to have the building blocks that we need to build the healthy chemicals to help us feel good, deal with stress and inflammation, and help rebuild our body.
Yeah, just to zoom back out, this cascade, this domino effect you're discussing could all happen from you scrolling on Facebook while you're sitting down to eat your lunch.
Totally.
And that's the important part. So I want to go back and just mention a few more symptoms of people that you have a need for enzymes and or increased stomach acid. If you've got undigested food in your stool, that's an easy one. If your stool is floating, that's an easy one, because we know therefore that the bile is likely not getting secreted, potentially due to a low fat or too low fat diet. So therefore you're going to have that issue. Also fingernails. So Justin and I, we talk a lot about fingernails. So if you've got chipping, peeling, very brittle fingernails, you've got ridges on the nails, that tells us that digestion's not good. You're not getting these trace minerals from your food. And then last one, we could just say anemia, right? Because if somebody's got low iron or ferritin levels, we know that they're eating grass-fed beef or bison or elk and all these delicious foods, but you're not cleaving off the iron. And so you got to have a lot of acid to do that.
100%. Again, a couple, just to kind of like piggyback on that, you have the fingernail issue. If you run your finger across the other finger, across the arch of it, it should feel relatively smooth. You may see some tiny, tiny lines, but when you run your finger over it, it should be smooth. You shouldn't see any white spots or little speckles on the finger. That's a sign of zinc deficiency. Your nail should be relatively strong. If you push it straight down on an axial lobe position, it shouldn't really bend. It should stay pretty straight and pretty strong. People that have issues with this, their nails will start to peel. They'll start to be more brittle and weak. You'll start to see vertical ridging and white spots. That's going to be your first kind of sign that you're not quite digesting protein and fat. And then obviously ionizing your minerals, especially zinc. That's number one. Number two, in females, it's super common. It's called keratosis pilaris. So if you look on a female's back of their arm, the tricep here, like this area of the tricep, you're going to see these like little dots, like these reddish kind of spots. And this is called keratosis pilaris, typically from essential fatty acid deficiencies. And a lot of times, if you don't have enough hydrochloric acid and enzymes, that will show up. So if you walk through airports or see lots of people, you're going to see that commonly on a lot of females' arms, especially birth control pills can exacerbate it more.
Why?
Because it affects digestion.
Oh, yeah. And my wife,
And
for example,
it affects nutrient deficiencies too, B vitamins, minerals, and such.
so I've got two personal anecdotes to what you're talking about. So when you first looked at me and you said, Evan, you've got a parasite. I
Hmm.
actually had two parasites and my nails were terrible. Now they're starting to get much better because I've cleared the infections and now I'm supplementing with enzymes like, it's water. I love them. I take them with every meal. But also my wife, when she was on birth control pill as a teenager, she had major keratosis pilaris on the back of her
Huge.
arms. It was crazy. I mean, massive amounts. And she thought that, oh, my mom had it, so I should have it. No, that's not the case. And so now with the fish oil, high potency fish oil, the enzymes, and then making sure the gut's healthy, it's gone. And it's amazing.
Yeah, I mean, typically, like birth control pills can affect the pH in the intestines, primarily the urinary tract. That's why one of the big things you see with females on the birth control pill, you'll see increase in yeast infections. It can affect the pH in that vaginal kind of environment, and obviously can have an effect in the gut too. So the more you allow negative competing opportunistic microbes to kind of invade in there, they're going to shift the environment to be more favorable to them. And that's going to take away from digestion capacity. And the more your digestion's down, harder to break down those proteins and fats and ionized minerals. And then you can start getting those deficiencies. That's why B vitamins and minerals and essential fats are one of the first deficiencies you'll see on birth control pills. So tying it back in here, enzymes are super important. A couple of questions from YouTube. pH, like the whole idea of pH, I mentioned, people say you want to be alkaline. Well, the question is where? Where do you want to be alkaline, right? When the stomach, you want to be very acidic. In the stomach or in the small intestine, you want to start becoming alkaline again. As you go back in the colon, you'll start to be a little bit more acidic. The urine typically is going to be a little bit more acidic because you're putting more acidic waste out through it. You're going to have bicarbonate that's going to bind with CO2 in the blood to help breathe out the CO2. So you're breathing out acid via the CO2. You're making bicarbonate in the blood. There's a lot of different pH regulatory systems that are happening. The biggest thing that's going to affect pH is inflammation. Inflammation is going to have an effect on pH 100 to 1,000 times greater than your diet. You'll see
Say
a
that
podcast.
again.
Yeah, your pH is going to have about 100 to 1,000 times more of an effect because of inflammation due to your body, not because of your diet. Now, your diet, you can have inflammatory things in your diet, such as grains and excess sugar and trans fat. But again, meat, people say meat's acidic, right? About a 5 or so on the 5 to 5.5 on the pH scale, which is logarithmic, but grains are 10 times more acidic than, let's say, meat. And if you listen to my podcast, it'll be coming out probably in a few weeks with Dr. Robert Rakowski, part 2. He talks about that aspect, that it's the inflammatory things in our environment that are creating far more acidity than our diet. But again, healthy green organic vegetables at every meal, you should be totally fine from a pH perspective, and then getting some good extra minerals in your multi-support, whether it's magnesium, potassium, calcium, those extra buffering minerals you should be fine.
Let's also bring up alkaline water and how big of a scam and ridiculousness it is to do alkaline water if your goal is to have optimal digestion, especially people drinking alkaline water. They buy these expensive machines where they're pumping out 9 or 10 on the pH scale of water, and you're drinking that with a meal. I mean, you're setting yourself up for failure. Now, could there be some type of therapeutic benefit of alkaline water by itself? I don't really know. Maybe you've got some advice on that, but for me, I'm going to go with a good spring water or a good reverse osmosis water with trace minerals back in like you do. I mean, for me, the alkaline water, it's just been debunked so many different places that it's just not worth even talking much more about.
Yeah, I mean, I'm not a huge fan of alkaline water. The question is, anytime someone sells me on alkaline water, I said, well, what are the buffering minerals that you're using to make it alkaline? And they typically are like, what? Because if you have just a really good, clean water, I mean, just adding some good quality electrolytes or a little pinch of high quality sea salt with a spectrum of minerals, you're probably going to be pretty good. And that may raise the pH up a little bit. But I'm not concerned about getting, having super, super alkaline water. I'm fine with drinking water that's clean and filtered, infuse some minerals back in. I have a little electrolyte solution I put by my reverse osmosis water filter. So I'll put a little bit of minerals in there first thing in the morning, or I have a little salt shaker there too, and I'll get some extra minerals. And that way, 1 to 2 glasses in the morning, 1 to 2 big glasses in the afternoon with infused minerals, and then just salt my food with good Celtic, or I typically like real salt better just for flavor and variety. But that's a good way to get the minerals. Not a huge fan of, these crazy expensive water machines that are alkaline. I think it's just a really high quality filter's better. And I like things like Pellegrino and natural sparkling water too, because of the extra sulfates that are in it, which are so good for detoxification too.
Yeah. So I want to ask you chicken or egg question, and then we can probably hit some of these YouTube questions about like hiatal hernias and HCl supplementation, all that.
Yeah.
It's hard to say, did someone get a low enzyme, low HCl state, which then led to undigested food particles, which then led to intestinal permeability or leaky gut, which then set them up for SIBO or parasite infections? Or did the infection come first? Like I told you about yesterday, I had a little 4-year-old girl that got her stool test back and she had 2 parasites. And it's like, that being that young, we would assume that HCl and enzyme production would be pretty good, being a tiny little kid, but she had tons of rounds of antibiotics. So it's like chicken or egg. Was it the HCl and enzymes that got low that then set her up? Or was it just the decimation of the flora via antibiotics that then set her up for infections? Which one do you think it is?
Yeah. So when it comes to infections, there's a couple of scenarios how that happens. Number one is you're stressed, your immune system's compromised, and you get exposed to some infectious debris, and your IgA and your enzymes and your hydrochloric acid levels are low, and you can't quite knock it out. It's just kind of like you leave the drawbridge down in the castle, you're flying around on the Star Trek ship, and the force fields are down. So invaders can come in, the Klingons can attack, right? Those are my analogies. Now, that's scenario number one. Now, scenario number two is you're relatively healthy and you get exposed to just a large bolus of infectious debris, right? You're hanging out and you're drinking some water in Mexico. You're on the beach in Bali. You're out in Lake Austin like I do, and maybe some water comes in your mouth and you get some Giardia, right? So those are the two major scenarios. And then scenario number three is, I would just say food vector, the compromised immune vector. Those are going to be the two biggest ones. There's a couple other ones, and that's going to be the animal vector. You're just getting exposed, or you're letting your animal lick your face all day, and you just you're not connecting the fact that your cat may have crypto, and now you got the crypto infection. Or I've seen it with dogs and Giardia. Super, super common.
What about this question here about, can a hiatal hernia cause hypochlorhydria? What's your experience from like a chiropractic perspective on hiatal hernias? Can you fix those chiropractically, and will that cause low stomach acid?
So regarding of hiatal hernias, and I just posted the link online for people on YouTube or Facebook that want to see the full kind of dual side of it. We only can do my side with the technology we have here. But regarding hiatal hernia, in my opinion, that you're only fixing a symptom of the hiatal hernia if you're doing a chiropractic adjustment for it. Now, I think that's fine because it's palliative, it's natural. You know, what's the risk to reward? Very little risk, only reward. We just want to fix the root cause. And typically that's going to be getting the inflammation vector away from the intestines. Once the inflammation's better, the nerves that go to those muscles won't be sending that inflammatory response that's creating that tightening. It's called a viscerosomatic reflex. Viscero is organ, somatic is muscle. So the organ and muscles are on a 2-lane nerve highway. And the more those nerves are stimulated, it's like the more you do bicep curls, the bigger your bicep gets, the tighter it gets, right? The more stimulation that goes to that area that's like pain, the more it can pull that stomach up above the diaphragm, which is basically a hiatal hernia.
Wow.
So you pull it down, but then you want to make sure you get to the root cause, inflammatory soothing nutrients, fix the infection, fix the ability to digest the food.
Okay, good. You answered the question, which was, so you can help with physical adjustments of hiatal hernias, but you also got to be working back to the root cause to make sure it doesn't just pop back.
Exactly. That's the key thing.
Okay, here's another question then. When can you start minimizing HCl? He's been taking them for 3 months. So I guess the question is there ever a time where you stop taking them? And I'll just go ahead and give my 2 cents first, which is not really. There's never really an expiration date of when you should minimize HCl, because if you look at Dr. Jonathan Wright's book, Why Stomach Acid's Good for You, and we look at age with the Heidelberg test, we see that HCl just drops and drops and drops every year that you get old. Any age past 20, actually, you start reducing HCl. So for me, I consider it a foundation, but what about you?
So a couple different theories on that. I think hydrochloric acid is the most underrated supplement in the toolbox for any functional medicine doctor and patient. I think it's absolutely essential, because if you buy a really awesome organic diet, healthy meats, healthy proteins, healthy fats, and you're not quite breaking it down fully, well, you're really not going to be accessing all the nutrients that are in those foods. So I think that from that perspective, it's a great insurance policy to access your nutrients from your expensive diet already. Number two, I think it's something as you get healthy, you don't need it all the time, but like For instance, I'm heading down to lunch here over at Perry's down in Austin. So it's like I'm doing a like nice little Friday lunch. I'm really excited about it. I'm going to bring some hydrochloric acid and some enzymes because it's going to be a nice little pork chop I'm going to have there. So we're going to up the HCl and enzymes big time. That's number one. Number two, if people don't want to be on it all the time, there are things they can do if they need a little support, such as Swedish bitters, whether it's gentian or chamomile or a little bit of ginger, can very easily just stimulate your hydrochloric acid levels, or even just a tablespoon of apple cider vinegar or a little bit of lemon juice can be really stimulatory for the hydrochloric acid. So there's ways you can stimulate it naturally. And also there's studies looking at gastrin, and gastrin's the compound that's produced in the stomach that actually feeds back to produce hydrochloric acid. And that compound, that chemical does not decrease as you take hydrochloric acid. So it doesn't have a negative feedback loop. So a negative feedback loop is you take steroids, right? Testicles shrink, right? The feedback is more of the steroids cause the testosterone and the internal production to go down. Now, taking that analogy to the stomach, as hydrochloric acid goes up artificially, gastrin levels don't drop. You don't have this atrophy happening. So it's good to take it if you want to give your digestive system a break, or you're eating a bigger meal and you just want to make sure you can break it down better so you don't have indigestion afterwards. Totally fine. Ideally, you shouldn't eat it all the time. And number three is you can artificially, or should say naturally, stimulate it with the bitters, the gentian, the chamomile, the ginger, etc.
Well, I kind of use the 3S rule too. Soup, salad, or smoothie. If you're doing any of those three, you could probably opt out of the enzymes and be okay.
100%, unless you have a lot of digestive symptoms. That's the key thing.
Yeah. See, there's another question here. Dale asked, can we share a quick functional medicine perspective on vaccinations? We'll have to save that for another show, Dale.
I went into this with Dr. Robert Rakowski last week. So I would say, Dale, check out that podcast coming up very soon. We go into that a little bit.
Here's Betty. She's got a question too. What's the logic behind antacids and PPIs? Profits don't count as logic. Ah, okay.
So I talked about this a lot. So PPIs, like if you're trying to create the perfect drug that works, but creates so many other issues that will create more pharmaceutical dependency down the road, it's the perfect drug. Let me walk you through it. So you have acid issues because you're not digesting your food, right? You have, the esophageal sphincters open, the food's not digesting, it's rotting in your gut, the acids are rising up and hitting the top part of your throat. You start having symptoms. The first thing you may reach for is an over-the-counter Tums, right? Calcium carbonate lowers the acidity. It works. You feel better. Eventually, you need to reach for like Nexium or Omeprazole or some kind of Prilosec, a proton pump inhibitor that prevents the hydrogen binding to the chloride molecules that makes the hydrochloric acid. So then you start having less acid reflux symptoms. It works. You feel better. Now, the problem is the more you shut down those proton pumps, the less stomach acid, typically the less enzymes. One of the things that starts happening is you become dependent on it because the gut lining becomes so irritated and inflamed. You're not digesting your foods. So then what happens is you don't break down the neurotransmitters. You don't break down the fat and the protein that become the neurotransmitters and the hormones. So you start having mood issues. So now your chance of antidepressants goes up. Your chance of having more anxiety because you don't have the L-theanine and a lot of the GABA coming in. So your chance of benzodiazepines goes up. You're not breaking down the cholesterol. So your chance of needing Viagra goes up because you have erectile dysfunction because you can't make your sex hormones. You become more inflamed typically. So then your chance of needing a cholesterol medication goes up because inflammation will increase your cholesterol. And the more you can't break down certain minerals like magnesium, your chance of lisinopril, hydrochlorothiazide, ACE inhibitors, blood pressure medications goes up. So you can see what happens. You're on this medication and all these other medications are needed to help manage all of the symptoms that come from it. It's crazy.
Yeah, I was going to mention some of the research too. I mean, there's research that links PPIs to kidney disease, dementia, heart attacks, bacterial overgrowths, infections, bone fractures, and also the fastest growing type of esophageal cancer. So there's a lot safer ways of dealing with heartburn than a PPI.
Yeah. And then HCl and enzymes are totally safe if you're pregnant too. I've had no problems with that with my pregnant patients. Not an issue.
Awesome. Should we go to other questions, or was
Yeah.
there other stuff you wanted to mention first?
I think this one other element about enzymes is taking specific enzymes on an empty stomach away from food can be excellent for cellular detox, cleaning up scar tissue, and even treating cancer. Dr. Nicholas Gonzalez, before he passed, was doing that successfully for many years. And taking high dose enzymes on an empty stomach, for me, that's a first line therapy for anyone with cancer. Those enzymes get into the bloodstream, and they're going to be able to digest any bad cancer cells that weren't tagged by the immune system for apoptosis.
And can you mention briefly just the types of enzymes? Because I think people may think enzymes are just one thing, but we've got digestive enzymes, we've got proteolytic enzymes, we've got systemic enzymes, which you were teaching me about last night. Talk people through just the different categories, just that way we know exactly what we're covering here.
Yeah, so you're going to have enzymes like amylase and such, which are going to be more your carbohydrate enzymes. Okay. You're going to have various proteases that help digest protein. And again, those will have different names like trypsin or chymotrypsin, right? Protease, et cetera, et cetera. And then you'll have various enzymes, lipases. And these will be more for digesting and breaking down fat. And then also you have bile salts that will kind of work synergistically with that. So those are your major categories: carbohydrate, protein, and fat. And like you said, the biggest people that tend to move away from meat are ones that have low hydrochloric acid and enzymes. So they move away towards vegetables, which actually have more natural occurring enzymes. So people that go vegetarian, right, they're thinking, oh, I just feel better on vegetables and not so much on meat. It's the meat's inherently bad. It's like, no, the meat is exposing a weak link in your digestive tract. That's what's happening.
Yep. Yeah, I want to give a brief anecdote about my use of proteolytic enzymes, specifically bromelain. After I got my wisdom teeth surgery, I was taking tons of bromelain, and my gums healed in rapid time. And the surgeon on the 1 week follow-up, he's like, "Evan, I've never seen anybody heal this quickly. What have you been doing?" And I said, "Well, I've been popping arnica like it's candy, and then also doing tons of proteolytic enzymes." And he was like, "Wow, this is cool." So it worked.
I love it. And then when you do these kind of enzymes for systemic use, there's a couple out there. They're a lot more expensive because you're using more serrapeptidase enzymes, which come from the silkworm. Silkworm, if you look at the thread that comes from their spinning, or whatever they produce from a byproduct, the thread that they make their nests with and such is incredibly strong. The tensile strength is unreal. So they're actually extracting the enzymes those silkworms make their net out of, and they're using it in systemic enzyme formulas. And they put these enzymes in enteric-coated capsules because you don't want to use digestive enzymes for systemic enzyme purposes, because they won't outlast the stomach. They won't get through the stomach intact. So you want something that's enterically coated that gets into the small intestine and then gets into the bloodstream without breaking down food. You don't want any food to be there. You want it to be on a full empty stomach. And we use high-dose serrapeptidase enzymes enterically coated. And again, they're going to be a lot more expensive than your typical digestive enzymes.
And when are those cases? I mean, what's like top few situations where somebody would want to be on that, the serrapeptidase?
Oh, yeah. So we're going to do that with any type of cardiovascular issues with history of blockages, cardiovascular wise. Women that are trying to dissolve endometriosis and fibroids, it can be helpful. People that have cancer issues that are trying to just knock down some cancer cells. And then also just for scar tissue in the joints, or just a general cellular cleanse to help cleanse out debris in the body. But again, none of these treat or diagnose, right? These are all therapeutic things to help support whatever health issues are already there. We just have to say that as our disclaimer.
Agreed. Yeah. So I want to just mention briefly about infection. So once someone's got an infection, regardless of how they acquired it, whether it was chicken or the egg, which happened first, once you've got parasites, you've got these SIBO situations, et cetera, you're set up for lower and lower enzymes and lower HCl. So it really is a long process that we take people through, where you've got to remove infections, you've got to restore the gut, you've got to restore the enzymes, you've got to heal up the gut lining and the damage. It's a long process. Samuel asked, or no, it was Corey here. He asked, what would be the best HCl supplement for somebody with SIBO, and should you take both HCl and enzymes at the same time? You want to hit on that one?
Yeah, take HCl and enzymes at the same time. Absolutely. Because
you have to, in my opinion.
I mean, enzymes, the only time I give them by themselves, if someone's gut's just really raw and they can't handle it. But again, hydrochloric acid will help your body make its own enzymes by activating it via pH, via low pH.
Well, and
So,
I wanted to mention too, you and I've both got professional enzyme formulas, but the dosing is pretty conservative for that
mhm.
reason. So you may only get 200 milligrams of HCl per one capsule of enzymes, and that's so low that unless you're just terribly inflamed, you should be able to tolerate such a low dose of HCl like that.
Yeah, in my line, I have two formulas with HCl in it. I have my Digest Energy that has lower hydrochloric acid levels that are meant for people that already have pretty good digestion, but just need a little bit of extra support. And then they'll have some enzymes in there too. And then I have my two that I break up for more people that have more digestive issues because we're trying to get more of a therapeutic dose. And some can't handle that much HCl, but need a lot more enzymes. So we don't want the fact that they're in the same capsule to limit how much we can give. So we can go lower HCl, more enzymes, or vice versa. And we'll kind of throw them through an HCl tolerance test, 1 to 4, 1 to 5 capsules on the HCl. Any warmness, we back off by 1. Enzymes will typically go up between 1 to 4. If we feel a lightening or better digestion or improved bloating or gas or any symptomatic relief or just a feeling of better digestion, then we'll keep it at that dose. If not, a standard 1 to 2 capsules per meal is typically okay.
Here's another question. My doctor put me on ornidazole and levofloxacin. Oh man, I had hunger pains, fatigue, constipation, felt better for a week, and then hit a wall. How effective are these and side effects? So those are two antibiotics.
Well,
And
anytime you take an antibiotic, one of the big side effects is going to be a rebound fungal overgrowth, right? Lots of females have noticed that when they take an antibiotic, they get a recurring yeast infection weeks later. And a lot of conventional physicians are actually growing wise to that. And they're giving their patients, their female patients, a lot of time, like a diflucan or a fluconazole after an antibiotic. Now, again, you're much better off giving them a probiotic. You can do it even during, just away from the dose, and then do a probiotics for a month or two afterwards, just to prevent that rebound overgrowth. And a rebound overgrowth is, let's say you have a lot of good and bad bacteria in your gut. You give an antibiotic, what happens is you lower all of it. Now, the good bacteria provides a nice environment so the bad stuff can't grow. So as soon as the good stuff is low, then the bad stuff naturally proliferates. It's the whole idea of once you clean out your garden, the tomatoes don't just grow automatically. The weeds do. You actually have to go in there and plant the tomato seeds or whatever you're growing. You have to plant those seeds. You have to aerate. You have to put the fertilizer down to create the environment so the vegetables grow. You
great
don't
analogy.
ever have to do that for weeds. The weeds automatically are there on auto dial, so to speak.
That is such a good analogy. Yeah, and it's amazing. How about, unless it's a life-threatening situation, try not to go with antibiotics anyway. Figure out what the root cause is. There's so many natural antimicrobials that you and I use, and they're so effective. They have no side effects, no lasting anything. They're in and out. And then
Absolutely.
you don't need stuff like diflucan, which is also terrible, which in many cases you're going to just basically piss off the candida. And yeah, you're going to get rid of it, but then the candida is going to come back with a vengeance. And we test your urine, we're going to see massive arabinose or tartaric acid.
Yep.
That candida is back
Bicarbonate.
with the vengeance. And they'll say, oh, I just finished a round of diflucan. It's like, whoa, well, it maybe worked for a day, but candida's back and she's mad.
Exactly. All right. So let's kind of summarize everything we chatted about here, Evan. So like, let's say you're just tuning in now, or you just got really overwhelmed and your eyes got a little glossed over. What's the Reader's Digest version? I'll let you go first.
Yeah. So to me, Reader's Digest version, enzymes and HCl are crucial. They are one of the most important foundations you should have if you want to be a healthy
Bingo.
human that lives a long life, plain and simple. And then the caveats to that are, well, do you have things in your body that you need to work with a functional medicine practitioner and get tested for, such as infections like parasites and bacterial overgrowth like SIBO and Candida? Now, if you get the testing piece done, you find out that you're free of infections, which is pretty rare, then awesome. Maybe you're just at a lower dose of HCl and enzymes, and maybe if you do soup, salad, and smoothies, you don't use enzymes, but otherwise you're kind of cycling on, and maybe you've got a cute little glass jar like I do that I shove in my wife's purse that's got my enzymes and HCl in there. I take it if we go to restaurants, and I always have it on the dinner table because if it's out of sight, it's out of mind. So when I sit down at the dinner table, the enzymes are right there. As you get older, we know with the work of Stephen Wright, HCl is going to drop. So to me, it's not an optional supplement if you want to be healthy. Mother Nature just doesn't care about your optimal digestion once you're 40 or 50 or 60 because you're past the hunter-gatherer reproductive age, which was like 16 or 20 years old. So Mother Nature doesn't want to kill you, but she just doesn't care if you digest your grass-fed beef when you're age 40 to 50. So enzymes become a must. You want to mimic the stomach acid levels of when you were younger and you quote unquote had an iron stomach. You want to try to match that with supplements.
Absolutely. And then in the future, what I'm going to do is anyone on Facebook, I'm going to put the link in for the live YouTube side, just so we can have people that want to see the full thing. They can go to YouTube to check out the whole thing. I wish we could make it go live on both sides here, but right now the technology doesn't quite do that. So we'll shoot over the YouTube link in the future. And just to add one last thing, get the parasympathetic nervous system response going. Make sure you're in a nice stress-free kind of relaxed environment. Make sure you're chewing your food enough times. Get the saliva going to help start the digestion in the mouth. And then last but not least, if you are really gluten sensitive and you may be getting exposed somewhere, like you're going out to eat and there may be some cross-contamination that you're not aware of, enzymes that have dipeptyl peptidase 4, DPP4 enzymes can be helpful, because that will help break down any bits of gluten. And the more the gluten can be broken down into smaller constituents, the better the body has just a chance of dealing with it better. So keep that as a little side note. DPP4 enzymes can be helpful.
When is the right and wrong time to use those?
Well, the wrong time is I'm going to have a birthday cake, but it's okay because I'm taking my DPP4 enzymes. It's not necessarily for that, but if you are going to have it, though, it will lessen the blow. But we don't want to give someone a crutch to be able to make a whole bunch of bad decisions. But if, let's say, I'm ordering some food at the restaurant and maybe there's something in the sauce, or you're just tired of people putting something in there, having it be handled by someone that just had gloves on that handled someone's breaded item. So you would do it more for incidental exposure, just to prevent that, so your body can deal with the gluten from that perspective.
Love it. That's great advice. So that should be in your suitcase then if you're traveling. We should do an episode on that. I think we did a travel hack episode.
We did.
We should do a on the go, like if you're not traveling, but you're just going out and about in the city and you may stop somewhere to get some food, what should you have with you just in case?
Totally. That makes so much sense. And I'm going to do maybe another Q&A. If I have time, I may do another quick Q&A today. We had a couple of people here that are asking questions that are a little bit off topic, which is fine, but we're only going to answer the ones that are more on topic. And I'll try to have more Q&A conversations where we can take care of everyone else's questions.
Also, last thing, if you haven't, you should sign up for SpeakPipe. That way people can send us audio questions and then we can play those audio clips and put them in for our podcast.
Love it. Great idea, man. Any last thoughts, Evan?
Nope. If people need help, reach out. justinhealth.com, not just paleo.com. We're available. And this is stuff we work on every day.
Love it, man. Well, you have an awesome Friday, man, and we'll talk real soon.
Take care.
Take care.
Bye.
Bye.